various objectives that we're gonna get comfortable. For you guys to know respiratory, dystocia, and trauma and emergency birds and how to treat these. And then hopefully by the end of this lecture, you will be more comfortable in the emergency room setting. And this is really meant for the emergency room situation, not for criticalists, not for specialists, strictly, oh my God, emergency runs for the door, what do I do? And this will help you feel more comfortable doing that. So I just want to run through the avian respiratory system really quick, just a review.
The avian respiratory system is the most efficient in the animal kingdom. The primary functions of the respiratory system are to supply oxygen to the body tissue and to carry away carbon dioxide produced by high levels of metabolic activity. In birds, this process of gas exchange is crucial because the demand for oxygen during flight is enormous. The flight muscles must receive a large and constant supply of oxygen to maintain flight, and metabolic wastes must be removed quickly. Unlike most land vertebrates, birds lack a muscular diaphragm to power respiration, and instead rely upon expansion of the rib cage to draw in air. When a bird inhales, air actually leaves the lungs. Fresh, oxygenated air enters the lungs as the bird exhales. The avian respiratory system is composed of the trachea, relatively small lungs, and usually 9 large air sacs. These 9 air sacs are extremely thin-walled and do not play a direct role in gas exchange. Instead, they serve as bellows to bring air into the bird and store it until expiration. They allow a continuous stream of air to pass through the lungs in a one-way flow, thus producing the most efficient respiratory system of any vertebrate. They are also connected to certain pneumatic bones, aiding the bird in shedding excess heat from its body as it breathes, which would be fatal if not removed. These air sacs include a pair of cervical sacs, a single interclavicular sac, a pair of anterior thoracic sacs, a pair of posterior thoracic sacs, and a pair of large abdominal sacs. All of the air sacs participate to some extent in the respiratory process. All of the posterior air sacs expand on inspiration, while all of the anterior air sacs contract on expiration. The path of a breath through the system can be summarized in 4 steps. During the first inhalation, the breath travels down the trachea, into the left or right bronchus, through the lung, and into the posterior thoracic and abdominal air sacs. As the bird exhales, the abdomen contracts, forcing the air out of the abdominal sacs and into the lungs. Within the lungs, the air passes through parabronchi and eventually through air capillaries. It is only here where the exchange of carbon dioxide for oxygen occurs. As the bird inhales again, the air within the lungs is driven out. The now stale air passes into the interclavicular, cervical, and anterior thoracic air sacs. During the second exhalation, the anterior sacs contract. The air is then driven out into the trachea, where it passes up and out of the nostrils. This specialization of the avian respiratory system is one of the greatest factors in flight. Without this unique anatomy, the act of flight would likely be impossible.
So this is just really a little review for you guys. You probably already know that, but I thought I would do it. So where do we start with these guys? When we have these respiratory distress birds, really important to get a history. So where is the cage located? Do they have self-cleaning ovens? Are they using Teflon? Do they use space heaters, air fryers? Because a lot of this on the history can give you the answer to why your bird is presenting in respiratory distress. And then what is the diet? Are they eating an all-seed diet? Are they eating pelleted diet? Are they eating fresh fruits, fresh vegetables? Has the bird been exposed to other birds? Has it had any prior illness or laid any eggs? And these are really important for you as you're coming up with your differentials for why your bird is coming in. And the other thing that's really important is your physical exam. A lot of times when these respiratory distress birds come in, you're really limited because they are in such poor condition that A, you're either afraid of touching the bird, or the bird is so critical that you're like, oh, if I touch this bird, I'm going to kill it. The bottom line is, though, that you need to do an exam of some sort. you need to get some weight on the bird. That's really important because if it is in respiratory distress, then you need to think about giving it a little bit of midazolam to calm it. We use a lot of midazolam in the ER for our respiratory distress birds just because it keeps them calm. So remember, if you can do a quick physical, palpate the crop, palpate the keel, get a weight, palpate the coelom. Does the coelom feel distended? Does it feel fluidy? Does it feel like, ooh, there's something hard in there? And listen to the heart if you can, and do an eyelid tint to evaluate your hydration status of your bird. So signs and symptoms, what are these birds going to look like when they come in? Well, they're going to either be dyspneic, they could have coelomic distension, they could have some open mouth breathing, they could have a tail bob, they could have weight loss, they could have lethargy. So those are usually your common clinical signs that these birds are going to come in with. So what causes respiratory distress? Well, I'd say a huge percentage of their female birds is reproductive. And they usually can have eggs, they can have coelomic fluid. Sometimes an enlarged GI tract or an enlarged liver will cause them to have respiratory distress because what you guys just watched on your video, they have those air sacs and those air sacs get compressed whenever you have any kind of organomegaly or any kind of fluid in that abdomen. Exposures to PTFEs, air fresheners, self-cleaning ovens that we just discussed, they could have pneumonia. The bacterial pneumonia, they can have psittacosis. Usually they'll get this if they're exposed to other birds. That's why on that history form, it's so important to say, hey, did you take it to the pet shop for feather trimming? Did you go to a bird show? Have you brought a new bird in the house? Sometimes, a lot of times, people will not quarantine a new bird, expose it to their established bird, and that bird that they brought in is a subclinical carrier, and it gives it to the old bird, and then the old bird gets sick. Viral problems can do it. Air saculitis and fungal diseases can do it. Little less common. They can get sinusitis from vitamin A deficiencies. Obviously, being on an all-seed diet, as you know, will cause vitamin A deficiencies, which then lead to immune suppression, which then you can get secondary fungal, secondary bacterial infections. And then lastly, you can get these seed obstructions. It's very, very common in our little cockatiels who are fine 1 minute that they get very excited when the owner is putting in maybe a millet seed or new seed. The bird will run over and start eating, and what will happen is they eat the seed very, very quickly. They're quickly ingesting the millet, and they'll aspirate that seed. And then when that seed gets aspirated, the bird will acute, just like someone choking. They will show acute clinical signs of sitting there going so when customers or clients bring in the bird, if they said, hey, my little cockatiel was fine, and we went to the store and we came back and all of a sudden he was doing this, the first thing that you want to think about is, hey, does this bird have a tracheal obstruction? So that's why your history, once again, is so important. So a lot of diagnostics, you guys are so great. You guys are lucky enough to have grown up in a generation where you have ultrasound. Ultrasound is your best friend in bird emergency situations. Before we had ultrasound, sadly, we had to subject these birds to radiographs, and sometimes we would kill our birds because we didn't know they had fluid in there, because we didn't have the luxury of ultrasound to go over and pocus these bellies and say, hey, there's a lot of fluid in there. Maybe we shouldn't take x-rays. So once again, your physical exam is very important when you're palpating these birds to know, is this bird stable enough for me to take an x-ray, or should I focus this bird? So ultrasound. Always, when you have a bird that comes in respiratory distress on your physical, if you feel that little belly and that coelom feels distended, the first thing you want to do is give that bird a little bit of midazolam and put him in a cage to let him hang out. Let him go in the oxygen and heated oxygen, usually the temperatures that we really like, 85 degrees. And then what will happen is you'll give your bird a little bit of midazolam. I will have dosing on the slide, so don't panic. And then once that bird has mellowed and he's in his little oxygen cage, you want to get everything ready before you go over and handle that bird. So what you'll do is, if you assume this bird has distension and you're like, "Ooh, I think this could be fluid," go ahead, bring your ultrasound machine over. Make sure you have your dilute chlorhexidine. We'll put that on a little cotton ball, and then bring a small gauge needle. Sometimes people like to use butterflies, anywhere from a 22 to a 25 gauge, 27 gauge, depending on the size of the bird. And then we always want to go in the caudal abdomen, to the right side of midline. And then, believe it or not, bring a 20 mil syringe to the party. You would be amazed at how much fluid you can get off of a teeny tiny little budgie. You can get up to 12 mils of fluid, sometimes even more. And you're amazed at how that bird is still alive. So please don't bring a 3 ml syringe, because you're going to have to undo the syringe, and you're going to have to then get another one, and you may have to repoke the bird. So to me, bring a 12 ml syringe to the party. And once again, you can always use a butterfly catheter if that makes you feel better, and then ultrasound, because like I said, you guys are growing up with ultrasound. You can put that teeny tiny probe on the bird and be able to tell what fluid is. And this is what it kind of looks like to give you a little orientation. Here's your keel. Here's our big distended abdomen. And we don't want to go on this side. That's the left side of the bird. And if it's a female bird, we worry because all the important stuff sits over here. So your ventriculus sits over here, your shell gland sits over here, depending on the species of bird. We're talking about cetaceans. Chickens too, sometimes chickens can have a right oviduct, but for the most part, cetacean birds, you have a left oviduct and a left ovary. So I will always go to the right of midline and a little more caudal, to remove that fluid. Let's talk about radiographs. So radiographs, if you've determined the bird doesn't have fluid and the bird is stable, then okay, yay, let's take some films. It is very important when you're taking bird x-rays to make sure these birds are in perfect position. This is out of all the species that we deal with, especially if you deal with exotics, dogs, cats, anything, it's okay if you tweak the x-ray sometimes if it's a little rotated. But with birds, we need 100% perfect positioning. Otherwise, that can really affect the way we interpret our x-rays. If that keel isn't perfect over the spine, we can make a misdiagnosis. So we want to make sure that these birds are properly positioned. So in this case, what we want to do is that we don't want any movement. A lot of times these birds trembling can make radiographs really difficult to read. Sometimes we want to anesthetize these birds. I love injectable. I'm a big fan of midazolam and torb. You can go anywhere from 1.5 mg per kg of the torb plus 1.5 mg per kg of midaz. Give it IM. If it's a teeny tiny bird, you can give it intranasally. I try not to give it intranasal in large birds just because it's large volumes and they may not absorb it as well. But there are periods of time where sometimes you need to give it intranasal for whatever reason. I do prefer IM. And then you can, if you need to add isoflurane, go ahead and add isoflurane if the bird is flapping, if your nurses are trying to take or your techs are trying to take these x-rays. And then what we want to do is we make sure you use some masking tape. Once again, you can use that to hold the head, the legs, and the wings in place, and it doesn't stick to the feathers. If you use white tape, you'll pull the feathers out. So we try not to do that. And once again, for our VD, we put them in dorsal recumbency. We extend our wings laterally and our legs caudally. Nothing frustrates me more than when I get x-rays of a bird that the legs are up or the wings aren't pulled out. It makes it really difficult for interpretation, because these things can superimpose the coelom and make, it can allow me to make a misdiagnosis. So it's really important. So if you want to take a picture of this, feel free to do that. And this is what it should look like when you're taking your films. So when you put your bird in your lateral position, this is what your lateral is going to give you. And then we have our trachea that comes down here. This is like the quick down and dirty for bird radiology. Our heart sits here, our liver sits here. We want this little perfect triangle. I always like this to be air-filled. And our lungs sit up here. And then we've got our gonads and kidneys and our GI tract. And then our proventriculus sits here, ventriculus. VD view, when you take your x-ray, it should look like this. Once again, this is your heart, and this is called the cardiohepatic silhouette. I always say it looks like an hourglass, and varying on the species, sometimes it's a little bit different of an hourglass, but for the most part, you want that hourglass appearance. And another thing that I'll look at really quick is I will look at the shoulder blades to the hips. I will draw a line from where the hip coxofemoral joint is up to where the humerus attaches, and draw a straight line, and everything should kind of fall in between that. But this is not a radiology lecture. This is just a quick of, hey, this is what your bird x-ray should look like. You know they're good if your keel overrides your backbone. So that will be really helpful for you. So when that bird comes in respiratory distress, our first thing, pop those guys into oxygen. Heated oxygen is great. Then give them a little bit of midazolam. And like I said, you can either give it IM in the pectorals, or you can give it intranasally, and then run and get your POCUS to see if you think there's fluid in there before you take your x-rays. So I'm not going to get into a big, long discussion about upper airway obstruction, lower. I mean, we could sit here for an hour and just talk about that. So we're going to make this very simple for you in the ER. So upper airway obstructions, I always consider it's probably a tracheal obstruction. And there are only a couple things that are going to cause that. So first, like we discussed, is that little cockatiel running back and forth, aspirates that little seed, it gets stuck in there. The other thing is aspergillosis plaques. So these are fungal plaques. Another thing to put into your mind. Usually when birds have aspergillosis, and these are usually big birds, it's not very common to see it in the smaller species. You're going to see a lot of this in your African greys, your Amazons, your macaws. So large birds, this is usually secondary to some kind of immune suppression. So what'll happen is the bird is in an environment, maybe the owner isn't cleaning the cage as much. They go to pull the paper from under the cage. That aerosolizes a whole bunch of spores. The bird inhales it. If its immune system isn't good enough, they'll start to build up these aspergillosis plaques. And then what could happen is these plaques can actually block the trachea. So once again, in the ER situation, your goal is to save this bird, not to figure out the ASPR, not to treat the ASPR. That's, I always consider the RDVM's job in primary practice. And then sometimes you'll see tracheal stenosis, which is usually can be due to intubation from a previous surgery. So in your history form, it's important to ask, did your bird have a previous surgery? Because then that should dawn on you, hey, maybe the endotracheal tube, they overinflated the cuff, and that caused a tracheal stenosis problem. So this little bird comes into emergency. So who's afraid to touch this bird? And don't be shy, you can unmute yourselves. And here's the history. So at the end of this, you all will not be afraid. You'll be like, I got this. So the history is a 27, it'd be great if it was 72, 27-year-old male African gray parrot that was actually DNA sex male. So the good thing about that is you can toss reproductive issues out the window as far as girl bird, and fluid in the coelom, no exposure to Teflon, air freshener, self-cleaning oven. Basically eats seed, some vegetable chop. The owner gives some vitamin supplements in the water. Owner cleans the cage once a month. Bird is kept in a back room. No exposure to any UVB light. No exposure to other birds. And over a period of time, the owner has been noticing that The bird isn't talking as much. And African greys, as you know, are big talkers. And this bird used to be a good talker until a couple of weeks that this owner noticed a voice change. And also the bird was not talking as much. And the owner's been noticed a progressive increase in respiratory rate over the past few weeks. So the bird was slowly starting to have an increase in effort before the owner said, oh my gosh, let me bring the bird in on emergency. So this bird would not be a bird that we ultrasound. Why? Based on the fact that it's a DNA sex male, which means it's less likely to be a girl bird. Girl birds sadly get all the reproductive problems. So less likely to be related to a sex issue. And then the open mouth breathing points me in a direction of, ooh, is this bird have an open upper airway obstruction? Because this bird is breathing with its mouth, as you could see in that video. And if you're unsure, no biggie, focus. If you don't see fluid, no biggie, no harm, no foul. Give the bird some midazolam. We don't want this bird panicking any more than the bird already is because the bird is in respiratory distress. And then put the bird in oxygen and heat. Then, once you've decided, hey, I think this bird has an airway obstruction, what are you going to do? Well, you're going to feel very confident because you're going to put an air sac breathing tube in this bird. Easy breezy. Remember when we watched that avian physiology, the breathing cycle, that actually allows us to bypass the trachea and we can put an air sac breathing tube in that caudal air sac. A lot of times if we're doing any kind of upper airway surgery in birds, we can anesthetize them through that air sac breathing tube. So you'll pop that air sac breathing tube in, you'll secure it, and your job is done. Your job as the exotic or animal emergency veterinarian or bird emergency is to put that air sac breathing tube and then move on from there and figure out what's going on with our patient. And things you need, you can use 11 blade, 15 blade, whatever blade you'd like. I prefer 15. A fine mosquito hemostat, a needle holder, and a pair of scissors, and some suture. And you can use a sterile endotracheal tube, and usually you'll cut it to appropriate length. So I usually cut it maybe 1.5 to 2 inches. A lot of times I'll use red rubber because those are a little more common to find in every practice as opposed to a specialty air sac cannula. If you work in a exotics only practice or a bird practice, you will have that air sac cannula. But when you are literally working in ER, they may not necessarily have that. So you can use plastic IV tubing. This is where your creativity really comes in. Your plastic IV tubing extensions that can be used, your red rubber can be used, any of the above can be used. So we're going to run through a quick video.
All right, I'm videoing.
See how easy this is? It is not very difficult. So what you'll want to do, some people like to pull this leg cranial, some like to pull it caudal. I like to pull it caudal, and then you'll feel this little triangle. It's the only soft triangle between your spine, your last rib, and your leg. It is literally this little soft spot. Just a couple points here is that I would cut this tube smaller because this is a lot of dead space. So I probably would cut this little tube here and then put my endotracheal tube attachment onto there, the thing that you pull off that then hooks up to your oxygen. But you don't have to put oxygen into these guys. They're breathing air. So as long as you create that, you're fine. And then you'll suture that in with the Chinese finger trap. And you're done. The other thing I always tell the students to make sure when you're holding your hemostat, choke that hemostat up so your finger is all the way in at the end of that hemostat, your index finger. And then I put my thumb very close to the tip because what you don't want to do is go through the other side of the bird. So literally it's just with a gentle motion that you'll pop into that air sac. Once you try this, and you should try this on a dead bird, it's very easy to do. And then you will feel very confident. Just an FYI, in the 33 years that I've been practicing, I think I've probably put 4 of these in, as it's not a common procedure, but in the ER, it is a lot more common as opposed to general practice. So in summary, if a bird comes in respiratory distress, the first thing we do, brief physical exam, palpate that belly. If that's the only thing you can get on that bird besides a weight, palpate that belly. And then palpate the crop, the keel, get the weight. Remember, palpate that belly to see if there's fluid in there. If you're not sure, give your bird a little bit of midazolam. If you kill a bird with midazolam, you just help that bird go to the light in a happy manner. So please, please do not be afraid to give birds in respiratory distress, any animal in respiratory distress, midazolam. You will never, ever kill it. It'll calm the bird down. It'll make the bird less anxious, you can save the life with just the midazolam alone. And then get your hydration and your weight. And like I said, roll your little pocus over there with everything that you need. And even if you don't have any fluid in there, then you can feel confident, hey, I could sedate this bird and get some x-rays. All right. So remember, if you have an airway obstruction, you put your air sac cannula in there. And then if you don't have any fluid and no in there, then the next thing would be to take some x-rays to decide what you think could be going on. But a couple things about taking x-rays in birds, always make sure the crop's empty. We do not want to anesthetize or sedate a bird if they have a full crop. Reason why, they don't have an epiglottis. So if you sedate that bird and you put it on its back, you potentially could aspirate the bird. So unless you're going to intubate the bird, make sure that that crop is empty before you sedate that bird for some x-rays. Now, what happens if there's no seed, there's no aspir plaque, there's no fluid? Now what? Well, in the emergency room situation, you're just going to give supportive care. And that supportive care consists of giving it some fluids at a dosing of 0.06 mils per gram. Vitamin A, D, and E, if you have it, that used to be called Ingicom. There are some companies that will compound it. There are certain states. Sadly, the state of California that I live in is a horrible state to be an exotic animal veterinarian in because we cannot get it. But if you can, you always want to base it off the vitamin A portion. And that's at 5,000 international units per kilo. A lot of times, the only thing that you'll have in the hospital will be the large animal formula, and you're going to have to dilute that down because that comes in as at 100,000 international units per mil. So you're really going to have to scale that down with your exotics. It's sadly a thing we have to deal with due to rules and regulations. Then you could give it some calcium gluconate. You will never harm a bird with calcium gluconate. In case it is a girl bird and it does have an unshelled egg, a lot of these diets are deficient in calcium. Owners do not have light. They don't have proper dieting. So, and in all else fails, you can start it on some trimethoprim sulfa at 30 mg per kg twice a day. I'm a fan of TMS. I think it's a great drug. And therefore, then you could send it off to the RDVM for further diagnostics. Obviously, if you have a vet scan unit in your hospital, you can run bird blood on that to rule out other things, liver, kidney, things like that. But from an ER perspective, respiratory distress bird, you don't need to do all that. So does anybody have any quick questions about that you want to ask before I see the chat exploding? And hopefully I'll be able to answer those questions at the end.
Is there a certain ultrasound probe that you would recommend us using for birds?
You know what? You want the the highest megahertz and the smallest imprint. So a convex probe is really good, but sometimes you're only allowed to use what is in your hospital. But a lot of times we'll use like an 8 to 12 megahertz probe with the convex. They do have these handheld units, which are great. A lot of the handheld units that they use, like the Edge ultrasound, has a very small imprint, and it's a convex probe, and you can actually get that, but any ultrasound probe will work. In all honesty, you're just looking for fluid.
Thank you.
Anybody else? Okay, so we're going to move along here. For our next thing that'll be the next thing that you're going to see is avian dystocia. This always tends to come into the ER at the nighttime. The bird always seems to or the owner decides, oh, it's time to run my bird to emergency. So the goal is for you to be able to recognize birds that come in with dystocia and know how to stabilize a bird with dystocia. And then know the reasons why birds get dystocia. And then how to treat an uncomplicated dystocia as opposed to a complicated dystocia. So few parrots are sexually dimorphic. In this case, this is an African ringneck parrot, and the males will have a nice little ring. And if you're lucky enough, you'll get this little eclectus, which is a boy, and you'll be able to tell. But for the most part, a lot of these cockatiels that come in, lovebirds, things like that, some cockatiels you can tell male or female. They're prolific egg layers. And just remember, birds can lay eggs without the presence of males. Most clients kind of look at you a little funny when you say that. When you say, hey, your bird could have had eggs, and they're like, well, it's not kept with a boy. You'd be amazed at how many clients don't know that the birds can have eggs without the boys. Remember, springtime is more common for them to be egg binding. Why? This is the time of year when they do lay eggs. So they're going to be more common in the springtime. And then usually, like I said, the most common species for egg binding are your little birds, your parakeets, your lovebirds, your cockatiels, your canaries, and your finches. It's usually a little bit less with the bigger birds, but it can be seen in bigger birds, but it's usually seen in our smaller birds. And then what can cause it? A lot of times it's vitamin and mineral deficiencies. Big one is calcium deficiency. A lot of these birds aren't exposed to UV light. So even, supplemented calcium, vitamin A, all of that, they need the natural sunshine to help with that. And a lot of times these clients have these birds on all seed diets. They don't have it on great diets like Harrison's. So they have a tendency to be on all seeds diets and no UV lighting. So they have a tendency to get egg binding. And a lot of these birds are fat. You stick these birds, I always consider it like a marathon athlete. The marathon athlete that runs marathons, they could probably sit on the couch and eat bonbons as long as they're running their marathon. But if you take that athlete and you stick them on the couch, feed them bonbons and don't exercise them, they're going to get fat. Same thing with these birds. These female birds, when they're fat, they go, oh, I'm fat and happy. I could have eggs now. So keeping them on the leaner side can help prevent that. Other things, if the egg is too big, if the egg isn't pointed in the right direction, or if clients are providing nest box, mirrors, toys, anything that will stimulate birds to lay eggs, they will lay the eggs. So an example of an egg pointing the right way, when we take an x-ray, we always want to make sure the pointy end is pointing towards the exit. If it is the other way, then the egg is the wrong direction, and that could be a reason why this bird is unable to lay the egg, because it is not pointing in the right direction. So what are we going to see when these birds run into the ER? They can look like anything. They can be dyspneic. They can have coelomic distension. They can be straining. The client may say, hey, the droppings are a little bit smaller. When you look in the cage, you see smaller droppings. They can be fluff sitting in the corner. They can have a tail bob. Usually they will have a wide base stance, and they can have paresis of a leg. So usually remember, left ovary, left side, left leg paresis, that should go into your head and go, ooh, maybe this bird has an egg, and that egg is compressing the sciatic nerve. If it's both legs, then it absolutely could be stuck in the pelvic canal and it is compressing both of the nerves in the legs. But usually if you have a unilateral leg lameness, I always think, ooh, maybe it's a left-sided oviduct issue. So we have two types of dystocia. We have an uncomplicated dystocia, and then we have a complicated dystocia. The uncomplicated is the one you hope for. And usually that bird will come in, it's pretty alert. It may just be a little bit off. It may just be straining. It may not be its normal happy self. It may be on the bottom of the cage shredding paper. These are considered uncomplicated birds, as opposed to our birds that come in severely dyspneic. They may even have prolapse because they've been straining so long. They may be in shock. They could have hemorrhage from the dystocia. And usually these clinical signs have been there for more than 48 hours. And the other thing that could happen is our uncomplicated dystocia can turn into a complicated dystocia. So we want to make sure that we keep a close eye on these birds when they're uncomplicated, because they can become complicated very quickly. So diagnosis, once again, if it's possible to establish the sex by asking the client, hey, has your bird laid eggs before? Is there a DNA sex test? When was the last egg laid? Remember, birds will produce eggs about every 24, 48 hours. And palpate that abdomen. Once again, ultrasound, your best friend. What you will see on ultrasound is all these perfect little round things. So you can't miss it. You can't confuse it for anything. It is a round thing inside the bird. It's an egg until proven otherwise. And then radiology, remember, only sedate them if they're stable. But these eggs, 99% of the time, you can put your ultrasound probe on there and you're going to see that round thing, or you're going to feel it. Our favorite friend, midazolam and torb. And if you need to, you can reverse these birds. If they're still so out of it after you've done your diagnostics, I like to let the birds kind of wear the drugs off of their own. So sometimes what I'll do is make a little nest for them with a towel. And once they're drugged, we'll put them in their little nest. As long as they're starting to come around and be alert, I will not reverse them. But in the event you're a little panicked, go ahead and feel happy to reverse them with the flumazenil. And remember, anytime you have a bird that you've sedated, make sure you give them heat support, flow by oxygen, and make sure you have a nurse there or a technician monitoring their heart rate and respiratory rate. Ultrasound, remember, if you see fluid, remove it first before you do anything else. Prepping the area with dilute chlorhexidine, giving oxygen, a small needle. I'm repeating this again in case there's fluid in there. And go to the right of midline. Aspirate the fluid, and then you can use a butterfly. And this is just a little picture. I prefer to keep my birds upright. I like gravity to help me. So what happens is I have my nurse holding my bird upright, and I will get my fluid out of there. And once again, here are eggs on ultrasound. They may be shelled eggs, they may be unshelled eggs. You may see fluid in the oviduct. Looks just like fluid on any other species. So fluid is fluid, eggs are eggs. Hopefully you'll only see them in birds and reptiles. So if you have an uncomplicated dysoscia, just assume that it's either caused by diet or chronic egg laying until proven otherwise. Give them some calcium gluconate. That will help because a lot of these times they've exhausted their calcium. Calcium is needed for oviductal contraction, needed to shell up that egg to get rid of it. You will never harm a bird by giving it calcium gluconate. And then your vitamin A, D, and E that we discussed, basing it off of your vitamin A dosing. Fluids, once again, prefer warm fluids. Put that bird in a dimly lit, humid, quiet cage. So usually what I'll do is I'll have an incubator in a room. I will treat my bird, give her her fluids, give her her calcium, give her her vitamin A, D, and E, put her in the warm incubator, and I will keep that incubator so humid that it looks like a little sweat box. I will go in there and spray it with water. I will put a towel in there, anything to create humidity, because humidity can help with those birds laying these eggs. There is a little thing called misoprostol. A lot of times, some clinics have these, some don't. It's used in dogs and cats for GI issues, but this works really, really well in dystocia birds. If you could actually see that egg in the cloaca, you can crush one of these tablets and mix it with a ml of sterile KY jelly, and then you could actually put this stuff intracloacally. Couple things to remember. Do not let pregnant employees touch this stuff, and make sure you wear gloves when you're making a compound, like crushing the stuff up and mixing it with the KY jelly. And I will use either an 18 gauge catheter, sometimes a curved tip syringe. If I can see that egg in the cloaca or see that little white shell, I will go ahead and infuse some of that in there. If you cannot, this will not help you. But a lot of times I don't even have to use this. If you provide that dark, humid environment, quiet, stress-free, that bird will lay an egg for you. So what happens when they don't lay the egg for you? This becomes a complicated dystocia when you've tried your medical treatment and either the bird has prolapsed, which a lot of times birds will come in already prolapsed into ER, or the bird is destabilized. So if you have a non-complicated dystocia, the bird comes in, it's stable, and then, hour or two, you keep checking on your bird, and your bird looks like he's getting worse. He's a little more fluff, laying, in the corner. Keep an eye on these birds. Don't just stick them in the cage and walk away. Make sure your nurse follows up on that bird and looks at it every 15 minutes to see, hey, does my bird look like he's getting worse? He's getting better. Does she look better? Things like that. So you want to make sure that you're keeping an eye on her. And if they become complicated, they're prolapsing, they may have some underlying oviductal pathology or breech position of the egg. So what do we do with these birds? Well, if you've got something hanging out like this, we obviously cannot leave the bird like this. So what we want to do is, after we're treating the birds, make sure you put these girls on antibiotics, because all this hanging out is going to cause a problem, and it's going to be painful. So the goal, stabilize the patient first. Fluids, put her in a warm incubator, oxygen. If we need to, anesthetize these girls to get these eggs out, and then prolapse reduction if it's indicated. Now, when this happens, they need to follow up with an RDVM or an avian vet, because even though you resolve this problem, there are other problems inside. Remember, another egg is going to come down that little chute. So you want to make sure you stress to this client, hey, you're going to need to follow up with an avian vet so that they can either give them, we use a lot of Lupron, we use a lot of implants, do a lot of spaying. There's a bunch of different things, but this is ER. So you'll say to them, they must follow up with a bird vet. Otherwise, bad things are going to happen, because we need to stop this bird from laying eggs. So here is a video on how to extract an egg.
Help get this egg out because this bird has not responded to medical therapy. So I've got numerous cotton swabs that I'm lubing up.
So usually what I'll do is I will use the cotton tip applicators. A lot of times you can get those cotton tip applicators around that egg and manipulate it out of there. Sometimes also what I'll do is I will fill up a syringe and use a 18 gauge catheter and squirt a bunch of lube up there to try and get these eggs out. In the event that you do rupture the egg, do not flush, because what can happen is you're going to flush all the pieces of shell back into the oviduct, and then that can cause damage and then adhesions and all sorts of problems. So we don't want to flush that. We just want to try and extract that egg as the best that we can. And then obviously put them on antibiotics and make sure that they follow up with NAR DVM. So we have this little conure here. It comes in, and it came in for ripping up newspaper on the bottom of the cage, and has decreased activity, all seed diet. They do not feed it Harrison's. They should. And no natural sunshine or lighting. It's kept indoors in a big cage. Client provides a lot of tools. So what questions do you want to ask this owner? And feel free to just shout it out. Don't be shy. You have to get over being shy.
Has the bird laid an egg before?
Excellent. What else?
Maybe what was the last time the bird egg laid an egg?
Excellent. Yep, absolutely. So, has the bird laid eggs? Is it eating and drinking normally? Have the droppings been normal? A lot of times what will happen is these eggs are stuck in there and they're obstructing the coprodiem and the urodiem, and the birds can't poop or pee. That's a problem. That, you know, they get all sorts of problems secondary to that. And then exposure to other birds. Where is the cage located? Things like that. Just a quick review. Remember, this is the urine part. This is the poop part. Usually these birds will come in looking polyuric, because a lot of times that coprodiem is obstructed with that egg. So make sure we're keeping an eye on these things. So our physical exam, we take this bird, the eyes are normal, the choana pupilla are blunted. Not surprised, if they had it on a pelleted diet, they would be much better off. Their heart rate is fast, their respiratory rate is increased. And you palpate something really firm on the left side, not sure what it is. And the bird has some decreased grasp in the left leg. The right leg has stronger grasp. And the cloaca has some mild staining present. Birds should never, ever, ever have any kind of staining in their cloaca. It should always be really clean. So when you're doing your physical, make sure you look at that back end. If you've got staining there, there's something wrong. So you feel the bird is stable. What do you guys want to do now?
Radiographs?
I like that. Awesome. You can focus.
Ultrasound.
Yep, I love it. Pocus, pocus, pocus. Like I said, you guys have this in almost every practice. And if you don't, it's okay. I grew up in a generation where we did not have ultrasound. I'm dating myself a bit. And when we had these birds with fluid, I just tap them. I don't even need ultrasound to do it. So if you're in a practice that doesn't have ultrasound, do not panic. Just go ahead and feel free. If you think that there's fluid in there, put a needle in there. What's the worst that could happen? You don't get fluid. Okay, pull out. The chances are, if you feel it, you'll start to feel it. That abdomen is tense and it's soft and fluctuant. More than likely it's fluid. And then you can take radiographs. So remember, when we take the radiographs, we want that pointy end pointing towards the exit. That will help tell us whether the egg is in proper positioning or not. If not, then you can spin that thing around like Dr. Johnson, who was doing in that video. What he did was he knew the egg, the pointy end wasn't pointing outwards. So he was just spinning the egg around with the cotton tip applicators to point it in the right direction. So if we have complicated or uncomplicated. So treatments, fluids, always give fluids. You will never hurt calcium gluconate. This, you're going to see an underlying theme here for all these emergencies. It makes emergency medicine for birds very easy. Warm incubator, humidity, misoprostol plus or minus, vitamin A, D, and E if you have it. So you guys did a great job, because here's our egg. So we have another case. Here's an unknown age girl that comes in with something hanging from her vent. Customer calls you up and says, hey, there's something hanging from my bird vent. And then it comes in and you're looking at it and you decide that it's an egg. And what do you want to do? And a lot of times this is a very, very common presentation in the ER. Clients don't realize it, or by the time they get to you, if they have to drive from a long distance, it's going to look like this. Do not panic, okay? This is fixable. So the good thing is you're the ER person, so you only need to stabilize this bird. You don't actually have to fix all this stuff. So what you want to do is, first of all, obviously get the bird stable, give it some pain meds, give it some fluids. Then what we want to do is that we give it a little bit of meloxicam, because that's going to create a lot of inflammation. Cord for pain. This is a great dosing for Torb at 1 mg per kg. Meloxicam is 1.5 mg per kg, and then fluids. So what I like to do is, when they look like this, is I will lube the heck out of these. I will take an 18 or sometimes 27 gauge. It just depends on the size of the, if it's a small bird like this, I'll probably use a 23 gauge catheter. I will remove the needle part and just use the catheter part. And I will actually put my catheter between the membranes and the egg. And I will try to peel it off. And once you can get a little space between this and the egg, once you start squirting your lube, go get like a 20 ml syringe. It's very, very messy. This stuff will come off. All this will peel back from the egg. I will just work my way 360 degrees around. Now, what will happen is, on occasion, while you're doing it, you're going to poke through this. Don't panic. It's okay. You're not going to kill the bird. I've poked through and poked through and poked through. So it's fine for at this moment. It is not fine later on. We have to deal with that. But for the emergency situation, the goal is to get this egg out and try to get it out in one piece. You'll read various things that will say, hey, aspirate the contents of these eggs, collapse it, and pull it out. We don't like to do that for several reasons. If you collapse it, you're going to damage this, which potentially could be the oviduct, could be the cloaca. We don't know what it is. So I prefer not to collapse eggs. Collapsing an egg is my very, very, very last life-saving resort. If I can't do anything else, then I will stick a needle in this egg, suck the contents out, and collapse the egg. And then I will grab the egg with a hemostat and try to pull as much, because usually the egg is pretty much together in one piece, and try and pull out as much as possible. Remember, don't flush. And then what I say is, once you've gotten that out, stuff everybody back in the house. You want to, don't worry about what it looks like. It's going to look horrible. You're going to be like, oh my God, this is horrible. Once again, you're the ER doc. So you just have to replace this, stabilize it, send it to a bird vet, and they can deal with the reproductive issues with the bird, whether it's spaying the bird, whether it's giving it the Lupron or giving it a Deslorelin implant. It just depends. But it does need to follow up because, you know, obviously there's been damage here and we don't just want to leave it and be like, okay, here you go, on your way. We don't want to do that. So the other thing is, once we've stuffed everybody back in the house, how do we keep everybody back in the house? Well, we put stay sutures in. And what I want you to remember is that we just want to go through the cloaca. So when you're putting these sutures in, so here is our cloaca. We want to make sure that we grab this part, which is going to be this, and then this part. And what you're going to do is you're going to do a simple interrupted suture. We do not put cruciate sutures, any other mattress sutures. We do not do a purse string in birds. We strictly do stay sutures. So what we're going to do is we're going to grab this part of the, and it is definitive. Like there is, once you push this in, you are going to be able to see this and be able to see this. So it'll make your life very easy to put your sutures in. So you're going to go ahead and put your stay sutures in on each side. So you're going to put stay sutures in, and those will stay in for 10 to 14 days. Make sure they follow up with the RDVM. Now, if you're not sure how close to place these to each other, I will put one or two Q-tips in the cloaca. So I know this bird is going to be able to pee and poo. If you get these stay sutures too close, the bird's not going to be able to urinate and defecate, and then you have a dead bird. So make sure that you go on the periphery and make sure you don't do them too far, because if you do it too far, you've defeated the purpose of the stay sutures, because the bird's going to prolapse between your sutures. So what you want to do is one or two Q-tips, and this applies to reptiles too. You go in the cloaca, you put your two Q-tips in there, depending on the size of the bird, then put your stay sutures there and take your cotton tip applicators out. So does anybody have any